For facial rejuvenation, we're often asked about the various face and neck lift approaches. And in order to do this, sometimes people are asking, oh, can I just get a neck lift? I want that in isolation. But really, these structures are interrelated. And if we're tightening the skin and the muscle underneath the neck, we're left with some skin excess and some deep layer laxity that needs to be tightened and be pulled up and around the ears. So these go together, and our typical approach involves being up and near the hairline or the tuft of hair just in front of the ear. We come behind the ear in what's called the tragus and around the ear for access. And then we usually come underneath the chin. And when we come underneath the chin, what we're doing is we're trying to find and identify the platysma muscle, which is an important muscle for facial mimetics and for communication, movement of the neck, as well as part of the lower lip. And with age, the two bellies of this tend to start turning down and becoming more vertical, creating these cords in the neck that can be problematic. So underneath the neck, we're removing fat on top of the platysma, removing fat underneath the platysma. Sometimes there's additional muscles like a digastric that has some extra thickness to it that needs to be removed. Also under the platysma, sometimes we can find the submandibular gland, and if this is too prominent, aspects of that can be removed. And ultimately, we're dividing a portion of the platysma, we're tightening that up and along the neck so that these cords are alleviated, and our goal is to have a crisp chin, throat distance and definition. At the same time, at the lateral or the edge of the platysma that's closer to the ear, we're typically manipulating that as well and tightening that, which can also help pull up the submandibular gland and give us some crispness along the jaw angle and that shadow. And this is usually contiguous with a deeper layer, a deep plane that is underneath the SMAS and platysma together, where we can come forward, remove buccal fat at times, or on additional facial muscles. And that layer is also deeply manipulated and repositioned further up the face. And all of these things begin to show us where there's skin excess, and any skin excess is trimmed and removed. But this is really addressing these planes in a deeper space, giving us a more comprehensive, long-lasting face and neck lift result. So thanks for listening. If you have any other questions, please check us out on our website, www.dereksteinbacher.com. Thanks again.